So choosing a supplement, just as a reminder, you really want to look for the USP symbol or purified, because what that's going to tell you is it really has been tested to make sure that it contains the ingredients on the label, it's pure from harmful substances such as lead and other metals, and it is dissolvable in your stomach. You should really note the serving size. It can be super tricky, just like the serving sizes on the food labels. So if you buy a bag of potato chips and you think, oh, great, it's like 200 servings for, 200 calories for the bag, and then you happen to see it says a 2 next to the number of servings, and you've now had 400 calories when you thought you had 200. So you really, again, want to look at the serving size on a supplement. The thing with taking a supplement is if, there are these different variations. There's liquid, there's, pills, there's chewables. Whatever one that you will tolerate, that you will take and tolerate, is the one that you should take. So we know in terms of calcium, it's carbonate and citrate, but I've had people say, oh, well, I can't take that on an empty stomach, and I'm not going to take this, I have to take it with food. What I've learned over the years is just find one that you can tolerate and that you will take and go from there. If you're taking in a multivitamin, it's what MVI stands for, you may not need it daily. Most people tend to just take it. If you're using it as a vitamin D source, then sure, you can take it every day, but typically it has so many water-soluble vitamins, and most people aren't really utilizing the majority of those nutrients every day. So I find that if you can space it out and take it every couple of days, you have more chance of allowing your body to use those nutrients in there. If you're taking a multivitamin and the next time you urinate and it's pretty yellow, that's probably where the majority of it is gone. This is a supplement label. So just to kind of reiterate my serving size point, this happens to be gummy vitamins, and the serving size is like 4 gummies, and it will give you all of the amounts of those vitamins listed on the label. But again, most people tend to not look at the serving size, so just be cognizant of that. With calcium supplements, if you've never taken calcium supplements before, I would start slowly. You want to drink plenty of fluids, meaning non-caffeinated fluids while you're taking it. Sometimes it's easier to just take like a glass of water, or if you're drinking seltzer or something like that. Divided doses of 500 to 600 milligrams of calcium at a time, meaning food and supplements. So if you take a calcium supplement every morning, but that's the only meal that you are getting dairy, you're having a yogurt, you're having cereal with milk, space it out, take it at another time. You should really try to space it out by a couple of hours. It could be at lunch, you could take it at dinner. And if you look for elemental calcium, as Dr. Starr said, it just makes it a little bit easier. Knowing what you're getting is what you're getting. Again, the most common types are carbonate and citrate. Carbonate, really, calcium likes an acidic environment. So carbonate likes to be sitting in there for a little bit longer. So that's why they say take it with food. It also helps with tolerance of it, avoid stomach upset. Citrate is, you can take with or without food, but it is calcium citrate is the one calcium supplement that you can take on an empty stomach. So vitamin D supplements, doesn't matter when you take them, with or food, without food, it doesn't matter time of day, whatever you're eating. These are the 2 different forms. D2 is ergocalciferol and D3 is cholecalciferol. D3 is typically the one that you're going to see in an over-the-counter supplement. D2, ergocalciferol, is typically the prescription, the high-dose weekly prescription. They both increase vitamin D in the blood. Something anecdotal, this is not based on any sort of research, but I've seen a number of people now that have been taking a very high-dose weekly ergocalciferol and has not budged their vitamin D. So just be aware, and of that. Just because it's not budging doesn't mean you need double the amount. You might just need a different form. Excessive supplementation, again, know what you're taking. I can't say that enough. I see so many people taking a bunch of things. They don't know what it is or what it's for. They heard it was good, Be an educated consumer, read the labels, and know, taking, again, a multivitamin, you might take it a couple times a week. That might be enough. Calcium, try not to exceed 2,000 milligrams or 2,500 milligrams max of food and supplementation together. More is definitely not better. And vitamin D, know your level before supplementing.